So let us welcome to the second part of Unit 3 of Paper 2. Now here today we will discuss about the beta-2 adrenergic receptor agonist. The name of that molecule is salbutamol. Salbutamol, you know that this is a chiral drug and which has the utomr is having R absolute configuration. Distomer has the S absolute configuration. Now, this salbutamol is used for the asthma patients and the COPD patient. The full form of COPD is chronic obstructive pulmonary disease. Means in general, those patients have respiratory breathing problems. Now, what is the mode of action of salbutamol? This is the fast selective beta-2 receptor agonist. So, selective beta-2 receptor agonist. Beta-2 means this is a subtype of adrenergic receptor. There are two types: alpha type, beta type. Alpha is divided into two subtypes, 1 and 2. Beta is also divided into two subtypes, 1 and 2. So now salbutamol works on selectively beta-2 receptor and send the biological response. So this is agonist. Now R salbutamol is UTMR and it is 150 times more active than S salbutamol, and it is 29 times more affinity towards the subtype beta-2 over beta-1. Now let us consider the synthesis of salbutamol, which starts from the salicylic acid. Now the first step is the esterification with the ethanol in presence of acid catalyst. So carboxylic acid becomes converted into the ethyl ester. Now what is the next step? Next step is the Fiedel-Crafts acetylation by using CH3COCl acetyl chloride. Nitrobenzene is the solvent and anhydrous aluminum chloride is the catalyst. Now where the acetyl group COCH3 group comes, that depends on the directive influence of OH and the ester group. Ester group is meta-orienting and OH group is orthopara-orienting. So the new COCH3 group comes at the meta position of ester and the para position of phenolic OH. Now we will go to the third step where this molecule is subjected to the side chain bromination. Means it is not a ring bromination, it is COCH3 group that becomes COCH2Br by using bromine in presence of acid catalyst. Now this bromine, that is in the next step, this Br acts as a leaving group and it is subjected to the nucleophilic substitution. The nucleophile is one amine, and that amine has the structural similarity with the side chain of the salbutamol. So what we are bringing is the secondary amine, which is attached with nitrogen, is attached with the benzyl group, tertiary butyl group and the hydrogen. Now when it interacts with this bromo compound, HBr goes minus HBr and we'll end up into this compound, tri-substituted aromatic compound. Now this compound has two reducible groups. So one is the ester group, another one is the C double bond O group. When this compound is treated with the lithium aluminum hydride, then it undergoes reduction. The ester group becomes a primary alcohol and the ketone becomes a secondary alcohol. Now the last step is the catalytic, it is hydrogenolysis, where by doing this, deprotection of the benzyl group which is attached with the nitrogen happens and it becomes a tertiary nitrogen becomes a secondary nitrogen. So with this salbutamol synthesis is over. Now we will go to the mode of action of salbutamol. Now salbutamol, as we know, that it is the beta-2 receptor agonist. Now beta-2 receptor is present in the our air pipe, means which is connecting the nose and the lungs. So now let us consider the cell membrane. In the cell membrane we have the receptor specific for the that is beta-2 receptor specific for adrenaline or noradrenaline. Now when noradrenaline or adrenaline neurotransmitters interact with the beta 2 receptors. Ultimately what happens is the muscle contraction, means broncho muscle contraction happens, means air pipe becomes narrow in the normal way. No, it becomes, so what it is, no, it is agonist, means that is adrenaline, noradrenaline interacts and it undergoes a mm, muscle relaxation. Now, when salbutamol interacts, then also what happens? The similar thing happens. Eh, mm, I mean, minimum what you have to understand is the when salbutamol is interacting with the beta 2 receptor and receptor then it is acting as agonist, and in the all these steps key ultimately you can skip all these detail. So when it interacts, finally what happens na, broncho smooth muscle relaxation, which the same thing is done by the adrenaline and noradrenaline, because salbutamol is agonist. What adrenaline, noradrenaline is doing at the beta 2 receptor, what biological response it is sending, the same thing will be done by salbutamol. So salbutamol when interacts with the beta 2 receptor, finally what happens? Broncho smooth muscle relaxation. Now let us go to the next slide. Now here we are discussing the beta adrenergic receptor antagonist, that is the propanolol. It is a LOL series. It is a member of LOL series. Means it is used for the treatment of the high BP for the patients which have already cardiac problem. Like this medicine can be used for the as anti-arrhythmic agent. Anti-arrhythmic or anti-arrhythmia agent means the patient whose heartbeat is not in rhythm. Vasodilator means the blood vessel diameter will increase, so therefore it will act as anti-hypertensive drug. Now let us see. So propanolol, atenolol, metoprolol, these are all the members of LOL series, where we will be having the structural similarity in the side chain, where we have the chiral center, that is ether linkage, aliphatic ether linkage, which has the at the end secondary amine. That part is same in propanolol, atenolol and the metoprolol. Metoprolol, and in all the cases S enantiomers are eutiomer. Now let us synthesize this molecule propanolol starting from the alpha naphthol. Now this alpha naphthol, if it undergoes a reaction with the epichlorohydrin, because of the nucleophilic substitution, what ultimately we get is the chlorine will not be seen and the epoxide will be attached with the alpha naphthol through one CH2. Now when this molecule will undergo reaction with the isopropylamine, then isopropylamine acts as nucleophile and the nucleophilic ring opening of epoxide happens. So this NH2 attacks the unsubstituted carbon of epoxide ring, so we'll end up into the racemic mixture of propanolol. Now this molecule has functional group secondary amine, so this can be subjected to the resolution by using optically pure chiral acid, as per example tartaric acid, otherwise the chlorosulfonic acid. One is R, another one is the S, and S is eutiomer. Now in a very similar way we can prepare atenolol. The only thing is, in place of alpha naphthol we are taking para disubstituted compound. One is the phenolic OH, another para position ki CH2 CONH2 group is there. Now when this undergoes the reaction with the epichlorohydrin, same thing happens in the via nucleophilic substitution reaction, chlorine goes and the oxygen is attached with the epoxide ring through one CH2. Then the same isopropyl amine comes, nucleophilic ring opening of epoxide happens. We get the racemic mixture of atenolol, which can be separated to the RNase by resolution technique using optically pure chiral acid. Now come whether it is atenolol, metoprolol or the propanolol, the mode of action, let us discuss the mode of action. It is beta adrenergic receptor antagonist, means when adrenaline, noradrenaline interacts with the beta adrenergic receptor, what biological response at that time it comes, that biological response will not come if lol series molecules interact with the beta adrenergic receptor. So therefore these compounds are called beta blockers. So now let us see that this is the presynaptic nerve and this is the postsynaptic nerve. In the postsynaptic nerve, the LOL series, that is the circles, empty circles are interacting, and so the biological response will not happen. In the synaptic gap or the synaptic cliff, neurotransmitters when adrenaline, noradrenaline are waiting, they are not getting chance to interact with the receptors present in the postsynaptic nerve. So the BP comes down, heart rate becomes normal, and in this diagram the black dots are neurotransmitters and the hollow circles are LOL series molecules, means beta adrenergic receptor antagonist. Now let us come to the next, where adrenergic receptors are over. We are going to the another receptor, that is cholinergic receptors. So cholinergic receptors means where the neurotransmitter is acetylcholine. So now cholinergic receptors are of two types. One is the muscarinic cholinergic receptors, another one is the nicotinic cholinergic receptors. Muscarinic cholinergic receptors can be activated by acetylcholine as well as muscarine, whereas the nicotinic cholinergic receptors can be activated by acetylcholine as well as nicotine. So these are the three structures which you have to practice. These are all important 4 marks question. Write down the structures of muscarine, nicotine, acetylcholine. Now the nicotinic cholinergic receptors are what it is called the mainly associated with the ion channels, and the muscarinic receptors are G protein coupled receptors. So when the acetylcholine binds with the muscarinic receptors, then a phosphorylation happens in presence of the kinase enzymes. And let us see the here we are representing the three diagrams: diagram 1, diagram 2, diagram 3. What happens now? See the diagram 1 where the this is the circle, this is the dendrite, this is the symbolic representation of neuron. This circle is the dendrite, this single straight line is the axon, and this Y type bifurcation is the axon terminal. Now this is again one circle, then this is the straight line axon, and the Y type is the axon terminal. So in between these two, that is what is there is the synaptic cleft, where acetylcholine is the neurotransmitter. Now when it goes to the gland, then also acetylcholine, it is the M type receptors are there, and acetylcholine is the, so first acetylcholine is the neurotransmitter. So first one is the first one is the N type and the second one is the M type. So this happens in case of the smooth muscles, cardiac muscles and the glands, like this chains are there to send the messages from the central nervous system to the peripheral nervous system. Now let us consider the diagram 2, where the this is the circle is the dendrite, this is the axon, and Y type is the axon terminal, and then at the synaptic gap neurotransmitter is the acetylcholine, and then there is another neuron which is going to the end. There the neurotransmitter is not acetylcholine, this is the norepinephrine, otherwise the noradrenaline. So so norepinephrine is interacting with the alpha 1, alpha 2, beta 1, beta 2 adrenergic receptors which are present in here. So this type of systems are present in the heart, it can be present in the blood vessel, it can also be present in the skeletal muscle. So this is the difference between the diagram 1 and diagram 2. Diagram 1, in both the neurotransmitters are acetylcholine. In the second diagram, one is the acetylcholine, the second one is norepinephrine. Now we will go to the diagram 3, where we do not have any synaptic gap. The one long chain, long neurons are there starting from the central nervous system. Directly it is going to the skeletal muscle. So this is the N-type cholinergic receptors are there in the skeletal muscle. So they are interacting. So they are the few cases which are present in the body for the signaling systems to send the messages from the central nervous system to the peripheral nervous system. Now let us go to the next slide, where we are discussing the one compound, artificial molecule, that is an atropine. So this is the structure of the atropine, and this is the competitive antagonist for the M type of cholinergic receptor. So this is the antagonist, means in the M-type cholinergic receptors, when interact with the acetylcholine, biological response goes, but when atropine interacts with the M-type of cholinergic receptors, then biological response does not go. Now, what it does, it dilates the pupil of eye. Pupil of eye means this is the black circle which you can see is the pupil. It increases the heart rate. It reduces salivation, means that our mouth becomes dry, and the other secretions. And for closing down the GI, for operations, it is required to close down the GI tract and the urinary tract for surgery, or in the eye examinations, means sometimes doctors may have to increase the size of that black ball in our eye. So at that time doctor uses atropine. So let us see the what is the mode of action. This is the cell membrane, this is the receptor, M type cholinergic receptor, and then atropine is interacting with the binding site. So therefore the acetylcholine is not getting chance to interact. So this leads to what it is called the it dilates the pupil of the eye, increases the heartbeat, that salivation secretion becomes less, shutdown of the GI tract and shutdown of the urinary tract happens. Now let us come to the another molecule that is also antagonist, but it is in the N type of cholinergic receptor antagonist. Atropine is M type muscarinic receptor ki antagonist. Tubocurarine is the antagonist for the nicotinic cholinergic receptor. So this is the structure, highly symmetrical structure. This with the practice only it will come. That is, nobody can help you. Everything is, if you observe all these things, some repetition is there. This bicyclic, this side quaternary nitrogen part, and this is the quaternary nitrogen part with methoxy, and all these things are repetitive. The little and these all are connected by what it is called the benzene ring with one CH2 and another side is oxygen. It is antagonist, and this is what it is called the used as a during surgery, used as the muscle relaxant. Now come to the next slide, where we will be having the these are very similar type of common diagram. Wherever you want, if you learn, try to use in maximum cases. Wherever it is agonist, biological response will happen. Where it is antagonist, then biological response will stop. So this is the N type of cholinergic receptor in the cell membrane, where the tubocurarine is present. So tubocurarine, if it is present, biological, it is antagonist, so biological response will not happen. So there is a no chance of acetylcholine to come and interact with the nicotinicholinergic receptor. So sodium channel will be closed, and as a result of this, smooth muscle relaxation will happen. This is mainly used for the surgery. And another diagram is there. There also, this is the presynaptic nerve, this is the postsynaptic nerve. That in between we have the synaptic gap, synapse or the synaptic cleft, where the dark colors, dark colored dots, black dots I have used for the tubercularine, and the circles, empty hollow circles I have used for the neurotransmitter acetylcholine. So drug molecule is interacting, so therefore this is what it is called, that there is no chance for the neurotransmitter to interact with the postsynaptic nerve, so therefore the muscle relaxation happens. So now let us consider the biosynthesis of acetylcholine. So so this acetylcholine neurotransmitter will be definitely synthesized inside our body by using the amino acid. So here the amino acid is serine. So serine is alpha amino acid, where the chiral, so this is serine decarboxylase enzyme is useful for the decarboxylation. So serine gets converted into the choline. Now you have the choline NH2 will be specifically subjected to the quaternization by using choline N-methyl transferase in presence of 5-adenosyl methionine is the methylating agent inside our body. So NH2 becomes N plus Me3, and the last step is the acetylation of the alcoholic OH2 OCOCH3. So that is the acetylcholine. It is done by the acetyl S coenzyme A. Choline acetyl, this is a reagent, and choline acetyl transferase is the enzyme. Now inside our body, this acetylcholine is synthesized by the three steps starting from the serine. First step is the decarboxylation, second step is the N methylation, the last step is the O acetylation. Now in the chemical synthesis, we do not do from the serine. In place of that, we start from the epoxide. It is, and the epoxide ring undergoes ring opening by using the nucleophile trimethylamine. So we get this N plus Me3 CH2CH2OH, which undergoes acetylation by using the acetic anhydride in presence of acetic acid. So acetylcholine synthesis is over. Now let us go to the next slide, where we will be having the succinylcholine. Now the succinylcholine, from the difference between the acetylcholine and the succinylcholine is choline ki that in place of the acetyl we will be having the succinyl. So this is the depolarizing neuromuscular blocker, the neuromuscular paralytic drug. So it is used for the surgery, and this is used for the what it is called, the during putting the ventilator. When a person will be, now people are very familiar with the ventilator because of the coronavirus problems. We know that a severe breathing problem patients can be given support by putting them in one artificial machine called the ventilator, where the artificially I mean the breathing will occur. So for such type of cases, that is the succinylcholine will be used for the neuromuscular blocker, means in another way, that is neuromuscular relaxing agent. So now let us see, that is the let us see the synthesis. Synthesis is the, this is succinic acid. When it is treated with the thionyl chloride or PCl5, succinic acid ki COH gets converted into the COCl. Now it comes, there are two COCl, so two molecules of that that molecule comes, that is so we will be having the succinylcholine synthesis is over. Now we will go to this cholinergic receptors are also over. I will go to the dopamine receptors. 5 types are there: D1, D2, D3, D4, D5, and these are all subtypes, and it comes under the two types, main types. One is the D1 and the D2. So D1 will be having first one and last one, means D1 and D5. Remaining three means D2, D3, D4 comes under D2 type. So that is D1 and D2 are in opposite functional, means D1 is increasing what it is called the concentration of CMP by activating adenylate cyclase, whereas the D2 is inhibitory, decrease the intracellular level of the cyclic AMP by inhibiting adenylate cyclase. So D1 type is the excitatory, and D2 is the inhibitory. Now let us see the biosynthesis of dopamine. Dopamine also starts from the tyrosine. This similar type we have already done from the tyrosine. So tyrosine will be subjected. The first step is the hydroxylation by tyrosine hydroxylase. This phenolic OH ki ortho position ki one more OH will come, so that it will be converted into the catechol. that is called as the DOPA. Now decarboxylation happens, DOPA gets converted into the dopamine. So this is the neurotransmitter biosynthesis of dopamine inside our body. Now see, that is the L-DOPA. Many times it comes in during our this thing discussion. L-DOPA is anti-Parkinson's medicine. That is not a drug. That is a pro-drug. It can be synthesized like this catechol and with the one extra side chain CH2CHO. When it is treated with the potassium cyanide and the ammonium chloride, this reaction before also we have done, that it gets converted into that aldehyde carbon becomes a chiral carbon, where the one extra cyano group will come and the nitrogen will NH2 will come. So this is a racemic mixture. This can, by taking the help of the NH2 functional group, this can be subjected to the resolution by using the optically pure chiral acid, tartaric acid, otherwise the camphor sulfonic acid. And plus we have to keep aside, and we have to proceed with the minus, because this is the um, compound enantiomer which is required for the synthesis of L-DOPA. Now this compound on hydrolysis, cyano group gets converted into the carboxylic acid. So this is the my L minus DOPA synthesis is over based on resolution. If anybody wants to go for the chiral synthesis of L minus DOPA, they can refer the asymmetric synthesis of paper 2 of SEM 3. Now come to the mechanism of action. Now L-DOPA is a prodrug and it is anti-Parkinson's medicine. It crosses the blood-brain barrier. Now the Parkinson's disease happens due to the deficiency of dopamine, but dopamine cannot cross the blood-brain barrier. So the precursor of dopamine means L-DOPA is used as a medicine. So L-DOPA comes, it can be able to cross the blood-brain barrier by taking the help of the carrier protein. Carrier protein is helping L-DOPA to travel this blood-brain barrier, and L-DOPA goes to the inside of the brain, where one step happens, that is by using DOPA decarboxylase. Decarboxylation happens, L-DOPA gets converted into the achiral dopamine and dopamine. So this is the agonist for the Parkinson's disease. So L-DOPA. So this is that reaction which is happening inside our brain. L-DOPA, by using the amino acid decarboxylase enzyme, decarboxylation happens and L-DOPA gets converted into the dopamine inside our brain, which is required for the treatment of the Parkinson's disease. Now next molecule, so L-DOPA is over. Now next molecule is chloropromazine. So from name it is clear that this compound contains one chlorine. So it's a tricyclic molecule, sulfur containing tricyclic molecule with a long side chain over the nitrogen, and one benzene ring contains a chlorine. So here we have the nitro group is there. So with the nitro group is the main functional group with respect to the ortho position and para position. Two chlorines are there. Now when it undergoes the reaction with the sulfur compound, that sulfur acts as a nucleophile. Sulfur attacks the chlorine, and one chlorine out of the two chlorines go. Now the question is, it is a out of the two chlorines, one chlorine specifically goes. Now if you investigate the structure of the starting compounds, the position of the two chlorines, then you can see that one chlorine is ortho with respect to the nitro, another chlorine is meta with respect to nitro. So in the nucleophilic substitution, ortho with respect to nitro, that chlorine goes. Uh, mm, so we get this compound. Now ACl goes, and in place of the chlorine which is ortho to the nitro, sulfur comes. Now next is the nitro group gets reduced to the bicatalytic hydrogenation, and we get the tricyclic molecule. Now we are only one step away from the chlorpromazine, means we have to do the N-alkylation. So that alkylating agent has the structural similarity with the side chain present in the chlorpromazine. So we have to bring like that only NMe2CH2CH2CH2Cl. So N-and-dimethyl 3-chloropropylamine is acting as a nucleophile. So the ACl goes, and that side chain gets attached with the nitrogen. So with this chlorpromazine synthesis is over. Now let us see that is the mode of action. This is the D2 antagonist, means the dopamine, and it leads to the schizophrenia. Schizophrenia means that those patients do not get the sleep. Now, the L-dopa, Parkinson's disease is due to the deficiency of dopamine. Now, this schizophrenia is due to the more concentration of dopamine at the what it is called the synaptic cleft. So, we have to reduce it by giving the antagonist. Depending on the situation, doctors give chlorpromazine. So, L-dopa is agonist, whereas chlorpromazine is the antagonist. So, now you see here the synaptic cleft has too much dopamine concentration. Now, when the I mean that interaction, there is no chance of if the medicine, means chlorpromazine, is in the binding site of the D2 receptors, then I mean that dopamine concentration, dopamine does not nothing to do here, and it will go back to the presynaptic node. So concentration will be monitored. Concentration of the dopamine can be adjusted by giving the mm, um, chlorpromazine to for the treatment of the schizophrenia patients. Now, these dopamine receptors are also over. Now, I will go to the serotonin receptor. Serotonin means 5-hydroxytryptamine. So, the natural neurotransmitter, natural agonist is the endogenous agonist is the 5-hydroxytryptamine. Pyridine nucleus की third position की CH2 NH2 is there, and the fifth position की OH is there. Now these are all seven types are there: HT1, HT2, HT3, HT4, HT5, HT6, HT7. Out of them, few are inhibitory, means two are inhibitory. That first one and the fifth one inhibitory means it sends the message for the inhibition of certain biochemical reactions, whereas the remaining five are excitatory. Another way is the out of all these seven types, only one is the ligand gated ion channel related, that is the 5-HT3. Now let us see the biosynthesis of serotonin. So again, serotonin, a neurotransmitter, since biosynthesis starts from the amino acid. So this is the L-tryptophan. So this is the pyridine nucleus is their third position. Ki CH2, the carboxylic acid and amino group is there. It's a naturally occurring alpha amino acid when it is subjected to the oxidation by using tryptophan oxidase. Then at the fifth position, regioselective hydroxylation happens only at the fifth position of indole ring, and then if it is subjected to the decarboxylation by using the decarboxylase enzyme, then we get the 5-hydroxytryptamine serotonin. Now let us consider the biochemical synthesis. Now let us consider the chemical synthesis of serotonin, which starts from the substituted properly protected indole 3 acetic acid. So indole ring ki fifth position ki O benzyl group is there, and the third position ki CH2COH is there. Now, when it is treated with the oxalyl chloride like SOCl2 PCl5, carboxylic acid becomes COCl, and then it is treated with the benzyl amine. So that benzyl C6H5CH2NH group comes, and nucleophile substitute means it gets converted into the amide. Now it is subjected to the reduction, means CO gets converted into the CH2. Hydrogenolysis means all of O benzyl group and N benzyl group both are subjected to the deprotection. So O benzyl becomes OH and the N benzyl becomes the NH2. So in this way we can do the chemical synthesis of 5-hydroxytryptamine. Now let us consider the function of serotonin, what it does. It is something related to our GI tract. So most of the body serotonin is found in the GI tract, where it regulates the bowel function, and the means movement of the GI tract has uh, serotonin has one important role. It also plays a part in reducing the appetite while eating. It controls anxiety and happiness. It helps to form the blood. If we get clot cut, then if it bleeds, then serotonin helps in clotting of the blood, and it stimulates the nausea. Nausea means a vomiting tendency. And then what it is called the when if we take the toxic things, so at that time we have to vomit to remove the toxic things. So serotonin has important role to create the vomiting tendency if we eat any poisonous thing. So with this, today's this part 2 is over. Thank you very much for cooperation.